In this procedure, you will learn how to perform a microhematocrit test accurately. Before you begin, wash your hands or use hand sanitizer. Put on the fluid-impermeable lab coat, protective eyewear, and disposable gloves. Assemble the materials needed. If the capillary tubes are self-sealing, fill 2 tubes by inserting the end opposite the sealed end into the well-mixed EDTA blood sample. Hold the capillary tube and the EDTA tube almost parallel to the table so that the capillary tubes fill easily by capillary action. When the self-sealing capillary tubes are 2/3 to 3/4 filled, tilt them upright, causing the blood sample to flow down the tube and meet the sealant. Continue to hold the tube vertical when the blood contacts the sealant for an additional 15 seconds. Duplicates should always be done as a means of quality control. Wipe the outside of the tubes with clean gauze without touching the wet open end of the tube. Touching the blood inside the capillary tube with absorbent material removes more plasma than blood cells and can alter the hematocrit. Place the tubes opposite each other in the centrifuge with the sealed ends securely against the gasket. If you are running more than one patient's sample at the same time, note the numbers on the centrifuge slots and record the numbers on the log sheet along with the patient's name. Secure the locking top, fasten the lid down, and lock it. If the locking top is not firmly in place during the spinning cycle, the tubes will come out of their slots and break. Set the timer and adjust the speed as needed. The prescribed time is 3 to 5 minutes at 11,000 to 12,000 RPM. Check the manufacturer's instructions for time and speed. Allow the centrifuge to come to a complete stop. Unlock the outer locking top and then remove the inner lid. Read the results immediately. If this is not possible, store the tubes in an upright position. Tubes left in the centrifuge will show altered results because the red blood cell layer will spread out horizontally. Determine the microhematocrit values using one of the following methods. If you're using a centrifuge with a built-in reader using calibrated capillary tubes, position the tubes as directed by the manufacturer's instructions. Read both tubes. If you're using a centrifuge without a built-in reader, carefully remove the tubes from the centrifuge. Place a tube on the microhematocrit reader chart. Align the plug RBC junction with the 0 line on the reader. Align the plasma meniscus with the 100% line. The value is read at the junction of the red cell layer and the buffy coat. The buffy coat is not included in the reading.
Two results.
Read both
the
tubes.
Two values should
For either
not vary
method,
by more
report
than 2%.
the average of the two results. The two values should not vary by more than 2%. Dispose of the capillary tubes in a biohazard sharps container. Disinfect the work area and properly dispose of all biohazardous materials. Remove your gloves and dispose of them appropriately. Remove your personal protective equipment. Wash your hands or use hand sanitizer. Record the results in the hematocrit patient log and document the results in the patient's medical record.